So my name is Tom Scott. I work at RTI International in the Policing Research Program. I've been here for about a year, and I'm going to be talking about a grant program that we've just started that RTI is evaluating. We haven't started the evaluation yet because it's just started, but I'm going to describe the program. And it's a program that uses funding from the Bureau of Justice Assistance through their Justice Mental Health Collaborative Program or Collaboration Program. And our program, or the program we're running with this grant, is specific to pre-arrest diversion for individuals who are suffering a mental health crisis. I'm going to present the program, and I'm going to try and leave about 10 minutes for questions about the program, but also I'd love to hear from you and have a discussion. There's roughly 18,000 local, state, tribal, and campus law enforcement programs. Everyone probably does something slightly different. So I'd love to hear what you're doing and if you're experiencing the similar problems and similar solutions. The project director for this program is Holly Howitt, and she's at Beacon in Lafayette Parish where this grant is being conducted. So the issue we're dealing with. Because of a lack of community-based alternatives, law enforcement is typically first responder to individuals suffering severe or in a severe mental health crisis. I'll define what that is in a little bit, but of all police contacts, research shows about 1% involve these types of crises. That may seem pretty low. It depends on how you define what a mental health crisis is. If you define it pretty broadly as someone who's under the or who has used substances, or maybe has a slight mental health illness, it goes up to like 20%. This is just specific to individuals who are the reason law enforcement is engaging them is because of their mental health crisis or what they're going through. That's about 1%. Compared to similar situations, contacts disproportionately end in arrest, usually for more minor offenses. So that's something we're trying to change. One of the reasons this is an issue is because law enforcement, surveys of law enforcement and interviews with law enforcement officers show that officers typically feel inadequately trained to handle these situations and sometimes frustrated by the alternatives to arrests that exist in their community. So in order to deal with this, this is also an issue that's been hammered today, and I think it's really important, is building partnerships and collaborations between law enforcement agencies and mental health agencies to better respond to individuals suffering a mental health crisis. So we are working in Lafayette Parish, Louisiana, and for anyone unfamiliar, parish just means county in Louisiana. So it's one county in Louisiana, and we're working with the police department and the sheriff's office there. Here's just a snapshot of 2017. These are the two issues we're working with them through this grant program. Calls due because of a mental health complaint, and then suicides or typically suicide attempts. So police response to this issue. And I showed a heat map just to kind of show you that these typically happen between about 10 a.m. and 3 p.m. during the day, during the weekday. And it's pretty stable throughout the year, month to month. For the police department, that's about 1% of their calls for service a year. So again, kind of replicate that 1%. So here's the possible dispositions in the police department's CAD for how they deal with this. And I'm sure these look pretty familiar to how the law enforcement officials in the room, how their disposition codes. So this is typically, the one in gold is what the police department and sheriff's office typically deal with these situations. In the vast majority of these situations, law enforcement officer shows up to the scene, deals with it somehow, and then is able to leave and restore the peace or end the call for service. For us, this is what we're really trying to change. The proportion of these crimes that result in arrest, we're really trying to move those charged dispositions into the referred to other agency. Now, there might be good reason to add some of the assistance rendered into referring to other agencies, but we're really trying to do the pre-arrest diversion. People who may have been arrested for a minor crime and instead referring them to a community-based alternative that might be able to help them and restore public safety. So just quickly about the grant. Again, this is grant funding from the Bureau of Justice Assistance. It involved a planning phase where the agency could evaluate what issues were most important to them in this area, and then an implementation phase, which we're in now. where we have identified the problem, these 2 call codes, and now are working with addressing it, which is what I'll explain. So specifically, this grant has to be administered jointly by a criminal justice and a mental health agency. It's making those 2 agencies come together for a grant-funded program. And the big thing it's doing is it's supporting cross-system collaboration to improve responses for these individuals. We're focusing, and it was kind of broad if you want to include substance abuse. Again, some of these calls do, but we're focusing specifically on mental illness. And there's an evaluation requirement because, like I said, there's a lot of ways you can come together and collaborate to solve this issue. And what we're really trying to do is build knowledge to see what works and what works for different jurisdictions and come up with, proven or evidence-based solutions for bringing the best outcomes to these issues. And again, this grant is focused on sustaining. Anyone who's ever received grant funding, I know things can be going great when you have the grants, but when they run out, it's hard to keep doing, keep applying that technology you may have had funding for. So one of the things BJA is really focused on is figuring out ways to sustain these partnerships and keep the momentum going after grant funding runs out. Okay, so our grant in particular, again, it's a pre-arrest diversion program, and I'll talk about some of the outcomes that we hope this will bring. Our partners, we have the Lafayette Parish Sheriff's Office, Lafayette Police Department, Acadiana area, and I might be butchering that name, Area Human Services District, and that's basically their mental health providers. So again, these community-based mental health opportunities exist in the community. A lot of times it's just, they're not on the same page with law enforcement on how to deal with individuals and what processes are available. And again, building that trust between partners. So they're coming in really as a seat at the table with law enforcement to better improve how the agencies work together. And then Beacon Community Connections is a case management, or I guess our case manager. So they've built a communication system for the medical and mental health services and law enforcement to access together to look at data and follow cases as they progress through the community-based alternatives, and also if it involves criminal justice, future criminal justice time. And there's 2 research partners who are conducting the evaluation. RTI International is conducting the outcome evaluation, looking at what effect this program has on calls for service, treatments received, and then the University of Louisiana at Lafayette's conducting what we call process evaluation, checking how these communication systems actually worked, how training actually worked to better improve the method of adopting the program in the future. Okay, so now how is this program going to work? The first component of it is the brief mental health screener. And for those of you who aren't familiar, the name is very descriptive. It's a brief instrument that law enforcement officers can use to screen individuals for mental health issues. Brief mental health screeners were adopted really for 2 primary purposes. The first is so law enforcement officers can better and more quickly identify the type of mental illness they're dealing with and the severity of that mental illness. The second is to provide more standardized and I guess more detailed information to mental health providers and medical professionals on what the individual's mental health needs are. It's for the law enforcement officers to help them with their job, and it's for the medical providers to help them with their job. And there's different versions during the planning phase of the grant. RTI helped Lafayette Parish, a working group, identify an evidence-based brief mental health screener that has been researched. Similar to the presentation just before, there's different versions of screeners. So we looked at data and found an evidence-based one. So the first component of this program is that officers must, in every call of these 2 call codes, perform this brief mental health screener. And law enforcement officers are trained on how to do it and the value of it, and it's tracked, how often they're doing it. So there's a training component to make sure that officers understand what it is and how to conduct it. It takes about 10 minutes, so again, it's brief, and I'm not getting into too much detail what these calls are like, but it's about a 10 to 15 item questionnaire, but dealing with someone who's in a crisis, I'm sure you can understand it's pretty difficult to get a lot of detailed information on their conditions. So again, that's something that's handled in training. And it requires direct communication and observation of the person. So it's looking at their behavior, it's talking to them, it's finding out, have they had any thoughts of violence in the past 3 to 5 days? Are they currently thinking of harming themselves? If they're having any violent delusions or hallucinations. And it also involves if there's anyone else, if, for example, if it happens at a homeless shelter, talking to someone who maybe knows that person there. If it happens at a home, talking to family, friends, neighbors to get more information. And then, in some cases, there are situations where the officer must make an arrest. But this is also supposed to help them select the best disposition for that person. And regardless of that disposition, the goal of the brief mental health screener and the encounter is to direct that person in the future to community-based services. So the first thing, the officer does a brief mental health screener, deals with the situation. Then what happens next after the encounter? So when officers enter in, this is an electronic form, the brief mental health screener, when they enter it, it's set up so it will send that information directly to the case management system, so that medical providers have immediate access to the person, and at least from the brief mental health screener, what their needs are. Then Beacon Community Connections, which again is that case manager, will use that information to contact the individual, whether they're in the jail, whether peace was restored and they're still in the community or still in a shelter, within 1 day of their encounter with law enforcement, to enroll them in the case management system. If enrolled, they make an appointment with a medical provider within 7 days, on behalf of that person, and also address needs. Do they need transportation help to get to that medical appointment? Do they have shelter? Do they have food? So it's within a day, they're having their needs treated for a longer term, hopefully mental health provision. And then they'll follow them for 3 to 6 months after that as well to make sure they're doing okay. So there's some type of wraparound care. And the great thing about this is it's not just law enforcement sends this person off and forgets about them. I know for law enforcement, a lot of times you're dealing with the same individuals over time, the same addresses, the same families, and it's worthwhile to check in and make sure the person's doing okay. So law enforcement can also access non-medically restricted information to see, is a person attending their counseling sessions? Who did they get set up with? So if you lose track of that person, okay, well, the local church is handling their case, I can contact them to find out more information. So it's really about connecting all the parties together to track and again, provide care for and protect these citizens and residents. Okay, so here are the intended outcomes of this program, which hopefully are somewhat obvious, but just to reinforce them. The first is divert residents in crisis going through a mental health crisis from the jails to community-based services. It reduces the burden on local sheriff's offices and jails, also law enforcement, and removes people who might be helped better through alternative means to the community. The goal is to provide higher quality and a broader array of services to these residents in crisis. Reduce burden on law enforcement and local jails by taking these cases outside of the hands of law enforcement. It's to improve public safety by, hopefully helping these people so they stop being involved in these incidents and public safety is restored. Developing partnerships and information sharing among law enforcement community organizations. That's really the big piece that we hope will last the test of time. Forming these partnerships, which hopefully through all of these sessions you've noticed are the key element of the strength of these programs. And through the research we conduct, we see a lot. These interagency communication structures and partnerships are really the key to success for a lot of different issues. And also providing the tools and training so law enforcement can better document and standardize and understand the issues that these individuals in crisis are going through. So the process evaluation is being conducted by the Picard Center. And again, that's not looking at necessarily is the program helping the people, it's more is training being conducted faithfully and for the goals that are being set out. If communication systems are breaking down, where is that and why is that happening? How can we better strengthen the task force collaboration and partnership and rapport? Understanding successes and failures. Then RTI is testing, is this program accomplishing its goals, which are to, hopefully reduce calls for service, both in general, from high risk locations like shelters, from repeat callers who are, consistently involved in the legal system and come to the attention of law enforcement. Also testing whether we're increasing the number and types of services received. So again, some of these individuals would have ended up in jails. Are these mental health providers providing a higher number, different types of services? Are they receiving different care than they would have previously before this program existed? And then also, hopefully reducing the number of these individuals who end up in jail. So for additional information, Holly Howitt is the executive director. She would be the best person to reach out to, but I'm Tom Scott, and also there's Mark and Andre who work on this program who you can also reach out to for more information. Okay. And again, I'll leave time for questions, but I'd really love to hear some discussion about how you're dealing with these calls for service, what programs you have in place, what partnerships you have in place. So I listed a number of questions I'd like you to think about, and if anyone has, a comment they want to make on one of them or an answer, things like, for your department, do you see the necessity and the feasibility of the behavioral mental health screener? Do you see these types of programs having an influence on officer safety, public health, public safety, what you're currently doing in your agency and what you would like to be doing if you're not doing that thing, and what your agency would need to put a similar type of program in place. So I'd love to open up the floor for discussion.
How you doing? We actually have the JMHCP grant here in Durham as well. My question was the brief mental health screening. You guys say you do it in the field, whereas we are actually doing it inside the facility, which kind of seems strange when we're trying to divert individuals with mental illness, from the jail.
What facility? The jail?
Durham County.
No, you said you do the brief mental health screener in the facility. What facility are you referring to?
The detention facility.
Okay.
Right. But I'd be curious just to see like what actual screening tool you guys are using.
Yeah, we can definitely forward you that too if you're interested.
Okay, thanks.
Sure.
Okay. So in North Carolina, mental health services and availability of mental health services is a huge issue. And I think in Durham, it's definitely happening that there's limited options for mental health services. So how is that being dealt with? Was there enough capacity, or are you all working on increasing the mental health services capacity in the community as well?
Yeah, we're not working through this grant on increasing services. I'm not familiar if the agencies are building capacity there. My understanding is it wasn't as constrained as other cities face. The big thing was just building the partnerships and the communication, the technology, like this interactive case management system. So you're not waiting a week on voicemails and playing phone tag to find out about a person's case. So those types of advanced structures weren't there, but they definitely weren't, finding funding to set up organizations to provide mental health services. So they were a little bit better than what I've heard other cities face.
Tom, quick question about Actually, two-part question. One is in terms of performance measurement for law enforcement or reinforcing performance. So, we've heard a lot that agencies still rely on citations and arrests as to help measure or look at officer performance. But I was wondering if there's any discussion about using this system to also reinforce these and show officers that are maybe more frequently diverting, and if that could be used to motivate other officers and be used to show positive performance and for their performance evaluations.
Yeah, so not to get too much in the weeds with research methods, but you're getting at an issue we had with is called benchmarking, right? So a lot of times these data didn't exist before the project started, like the number of needs, the type of needs. So how do you measure whether participants are increasing the number of needs that are met? But we can see that, if 90% of the individuals in this program had transportation needs, and that was never addressed before this program, you can start to see how this program can start to identify needs to get more people who may want to go to their services, but are just, won't go on their own. And those services are proven to be effective. So theoretically, if you get them to their appointments, they receive more services, which reduce their likelihood of, continuing to having their mental health needs continually negatively affect public safety and law enforcement. So we're documenting a lot of information and showing, I think the key finding in part will come from the process evaluation too, because you're showing that communication's increasing, the types of communications increasing. So it's not just about reducing recidivism, it's also about, you can measure the strengths of the partnerships and the types and level of communication as its own outcome. So it's more difficult to get that clear. There's a 10% reduction in recidivism here, but there's definitely, I think, ways to show and test. We haven't done the evaluation yet. We believe that this program will be effective because we're applying evidence-based programs, but to test and show whether or not it improves the needs of those individuals in the community and law enforcement's needs as well. Did that answer your question? Any other thoughts on the discussion topics? Everyone's ready for break? All right. Okay, well, thank you.